Hi, it's Dr. Craig Zeman. We're doing a Bankart repair. This is a guy who first dislocated his shoulder approximately 7 years ago. He's had multiple dislocations and now they've continued. You can see here he has a pretty large Bankart lesion right there. We're in the anterior portal, and then he also has a SLAP. Already kind of prepared that for repair, but he peels back pretty far. So what we try to do is I burr the bone down a little bit to help fix with the SLAP, like that. You make a bed for the labrum to lay down on. We'll do the same thing down in here. And then the next most important step is now mobilizing this. Liberator is just kind of like a small little osteotome with this curve. You can see I'm going through the anterior portal. You can see the synovitis he has in here from his repetitive. And then you just have to go carefully along, freeing. Got to be careful that you don't lunge too much. Eli, can you come and hold the camera? Sometimes I have the assistant hold the camera. Eli, he's good. That way you don't plunge. You don't want to get the axillary nerve. And so I use both hands on the liberator. This also kind of scrapes up the glenoid. Once you free it up, see there, we're freed up pretty well. Then I'll even try to pull it away. Now I'm pulling, you see that? To loosen up that labrum. You want to kind of get down inferior as far as you can. Grasper. So I still don't like the mobility. It's okay, but not the best. So we'll free it up some more. So I freed it up a little bit more, went down inferior, came down way down there, got it all free. You can see how far the elevator, and freed that tissue up nicely. And now we get the mobilization we want to fix that Bankart like that. I like to kind of come down inferior, down in this area right here. I'll use a needle to kind of help me, guide me. You can see me hitting the subscap. And then that gives us a pretty good shot to get the anchor in. Right in that area, and we're kind of down low. Pull that. And I'll usually go in with a metal cannula first. You can see how we're coming in. And then we're kind of inferior, so see you can pull down the subscapularis tendon like that. And I'm pulling down there with my hand. And that gives us a good shot on right in there for a repair. And then I think that the metal cannula gives us a little tunnel to follow. I don't use dilators. I keep everything pretty tight because I don't like my cannulas coming out. You can see that's pretty tight. That one's even there. They do kind of sometimes get in the way of each other, but that's all right. Let's do a shuttle relay first. I forgot all about that. Guess we could just leave these cannulas in there and he'd heal. That's a joke, obviously. So we kind of want to get down inferior, try to pull up his inferior pouch. try to get a bigger bite than that. Now that looks like a good bite. Yeah, that brings it up nice. I find it easier to get your shuttle relay in first before you do your anchor, because then you're not having to worry about tangling up every. Here, it's not spinning very well. Can you hold that? Pull on that black. And up at the top. Yeah, just hold it. There we go. Okay, grasper. So I use the Arthrex 2.8 anchors. They're supposed to be self-drilling, but I find that you get in trouble if you do that. Are you ready to go? Okay. Okay, go. So I've had them get stuck in hard bone, so now I just pre-drill. That way I don't have to worry about it. So you can see this guy's bone's hard. Okay. Put the cap in there. Then you want to, sometimes it's hard, you got to sit there and hold it. The other thing is you can see him putting the anchor in. One of the keys, you really want to make sure you tighten down the chuck real well. I make sure they tighten it in all 3 holes, okay? That way you don't have slippage, because there's nothing worse than the momentum of this thing taken down and then your anchor slips. Then you got your anchor sticking out, and that's no fun. Go. Go. Give it to it. Go. Go. That's it. Good. And then here you just got to make sure you're off all the way, or sometimes you'll grab the clear plastic cap, and that can pull your sutures out if he gets too aggressive and pulls it out. Then you pull that cap off like that. I usually find it goes down in the bone pretty good, so I just use vice grips to hit it. Kind of saves you time of whacking around. Go. Transfers the force better, and then it comes out well. Crochet hook. So I pull the one out. It doesn't matter what one you pick. Okay, grab one of those sutures, pull on one of them. Let go of the, pull on the right one again. Hold that one, let go of the left one. So as long as you don't see any movement down here in this V, then you know you're safe, okay? And then I just have them test it. Sometimes this is kind of a pain because of the angle. It messes up your, go ahead and load that. It'll mess up your shuttle relay because we're kind of making a, yeah. So he's going to load that shuttle relay in there. And then you just leave a little tail. You don't have to have a huge tail. That's good. Yeah, don't pull too hard. And there you have it. And now you can see we're going to pull that lesion up real nice into that area. I just do 2 simples. They tend to kind of lock each other down. And there it is, locked in place. So now you can see how that brought that in. Now we're going to put another one in there. Hand me the grasper again. We're going to come up and grab that other inferior tissue and then stick it up there. Now I may be coming up above the equator, but that's kind of, I like to do a little bit of a shift at the same time. So I think it's okay to come up if you're shifting the tissue and pulling it up. You can see, look at it, how we kind of pulled that, made this down here a little tighter. And you can't, he was able to open up pretty far, and you can see that we got that pretty good. You can see in some ways, if you're going to try to keep that nice labrum, you really got to come up around that far. I pull it out sometimes because you kind of really don't know what ends what. So stop. So you can really see this guy's bone's really hard. You're really happy, or I'm really happy that we pre-drilled that, because a lot of times that 2.8 anchor, it's just going to get bogged down in that bone. You're just safer off doing it pre-drilling. And as I said, you can see that we're up pretty high, but once again I'm shifting the tissue because he had an MRI had a pretty redundant inferior pouch, so I kind of want to close that up. And also he's got a pretty good sized hill sacks. Go. Keep going, go, keep going. Stop, right there, that's good. You can see how nice that just goes in there. Then you're going to see how well this shifts up the labrum, and then makes a really nice wall, because sometimes you got to pull that tissue up to get the good labral buttress, in my opinion. Now you can really see how how that's just gonna pull that labrum up really nice, buttress that up against there, and now he's got a nice restoration of his labrum. Clinically, I haven't noticed an issue with where the knots are in the joint. I don't have people complaining too much. I think one of the things I do in the pre-op is I make sure that I tell them that there's always going to be some kind of clicking inside your joint, which I think is just true, period, no matter what you do. And sometimes when I've had to go in, some of the anchors loosen up, I've noticed that this tissue just gets all encased in synovium or scar tissue. And so now you can see you got a nice little buffer of tissue right there, nice labral repair. It's nice and tight. You can see that. But now you can really see that labral tissue, and it's just snug up against the bone, up on the rim. I think he's got a little bone loss, but I think there's some bone up in this with this tissue. So I think we've given him some more length, and hopefully he won't redislocate. I did discuss with him about the possibility of maybe having to have a Bristow procedure if he dislocated again. You can see back here he's got a hill sacks back in that area. So now we're going to address this SLAP. For the SLAP, I just make a little incision right over here. I take my anchor. I like this angle, and you don't have to make a very big incision. Yeah, we're going to need another anchor. Give me the sharp one. No, the sharp, can't, this, there you go. You got the drill ready?
Oh, you want another?
Yeah, we need another anchor.
Another anchor. Okay.
Usually you can get right through the interval. You got to use a sharp one to kind of get in there. Once again, we got this in. We got them ready. Hand me the shuttle relay again. And so I'm going to do the same thing as we've done. Yeah, as we've done before. Make sure you put this in first. This helps with the having less complicated. So on this one of the things you're going to really have to think about is where's the suture coming from, where's the suture going, and how are you going to pull the suture through. Because you don't want it, if you're not careful about where you're doing it, because if you notice I went reverse of what I was planning on doing, then everything gets kind of wrapped up on itself. It's not necessarily the end of the world, but so I guess what I'm saying is that this is where we're going to be wanting to pull a suture through here, out to here is what we want to do. So we're going to be bringing the suture through the green cannula and then pulling it through the other cannula. Okay, you ready with the drill? Okay. Go. Go. Keep going. Good. The bone seemed a little softer up on top, so let's just see if this comes out easier. And you see that it does. Crochet hook. As I said, we'll pull one of these sutures out through the green cannula. And you just always pull on one of the sutures. Let go of that one. Yeah, let go of that. Notice again, once again, the V's not moving. I forgot who I learned that from at the academy. No, it's coming out this way. It's coming out the green one. Okay, so load it through the green. Then we'll tie that down. I think that'll be enough to kind of fix this slap. Okay. That didn't make it all the way through. Hand me the grasper. And where did that come from? Okay. Once again, as long as you're not... Okay, whoa, stop. So now you can see we're kind of tangled. That happens. One thing you want to do with your tangles is make sure you address them before they become a huge problem. Once again, if you notice, there's nothing, relax, let it go. There's nothing happening at the V.
Oh, we may be upon a broken guitar in all the streets, the wicked tropical charms, the embassies. Lying hideous shards where tourists snore in the